I'm Dr. Ashwin Vasan, New York City's Health Commissioner. I grew up in Chicago, the son of immigrants from Chennai, India. From an early age, I was inspired by my mother, a pediatrician who primarily cared for children from underserved Black and Latino communities. I saw then, as I see now, in my own primary care practice, how social forces like economic inequity and food and housing insecurity, and the policies and the politics that shape them, clearly impact individual and community health and well-being. I then spent a decade working around the globe on HIV and health equity, which solidified in me the notion that health is a fundamental human right. Closer to home, I see the impact that the COVID-19 pandemic has had on the emotional health and development of my 3 young children. And I know what's at stake if we don't prioritize the mental health of all of our city's children. As the city's doctor, I'm committed to ensuring that all New Yorkers have the mental health care, support, and resources they need to flourish, especially children and those living with serious mental illness. This includes responding to our increasing opioid epidemic, which is taking the life of one New Yorker every 4 hours. We will be facing the second pandemic of unmet mental health needs for years to come, and we must act with urgency and focus. As a city, we will work to expand access to quality and affordable mental health services for all New Yorkers. We will create the social infrastructure needed to bring people together, out of isolation and despair, and onto a path to recovery. And we will work with our partners in Albany and in Washington to reform policies and address the social determinants of mental health, including the effects of trauma. We will take a public health approach to our mental health crisis to help stem the tide of mental health conditions before they arise. Rest assured, the health department remains firmly focused on managing the ongoing COVID-19 pandemic. This virus continues to humble us, and that's why we are prepared for anything that it throws our way. For you and your family, this means getting vaccinated, getting boosted, getting tested, and getting treated as soon as possible. We have more tools in our toolkit than we have had at any other point in this pandemic. And so, even as we continue the everyday work of protecting and promoting New Yorkers' health and well-being, we are prepared. Our work at the health department is vast and broad-ranging. You will see it in the restaurants we inspect and grade, in the health clinics we run, and the birth and death certificates we issue. Our epidemiologists and other behind-the-scenes heroes and experts investigate daily the patterns, causes, and effects of illness and design programs that address the root causes of chronic disease and premature death. All of this and more is the work of public health. And just as my mother modeled for me, the New York City Health Department remains committed to centering equity in all of its work. We will continue to address the social determinants of health and to strengthen our neighborhood-based programs to meet the needs of communities hardest hit by COVID-19 and the systemic racism that has led to long-term health inequities. I look forward to hearing from you, my fellow New Yorkers, about your health priorities and about what we can do to help you, your family, and your community live your healthiest lives possible.